manage everyone's time well. We do have some folks on from CISAs, and I like to see your names, but if you do know what CISA you're in, if you can rename and put your CISA after your name, then the CISA folks that are on here are able to identify. I think what's difficult, Marcy, is that we've got multiple people from districts, and I kind of like to see the names when people are asking questions. Okay. So we're going to get started in a moment with a few polls, just a few housekeeping things, if you will. There's a lot of stuff that we're going to talk about here, and I really like to be flexible with questions, but I'm going to ask you to think about if your question is asking for some clarification about something that I've talked about or I've shared, please put that in the chat box and we'll try to answer it as soon as there's a moment to do so. If your question is about something that hasn't been talked about yet, I'm going to request that you wait till the end. We've got plenty of time that we can do some of those questions, because your question might get answered in the material that I share. There's actually quite a bit that we're going to talk about. So the other thing is that I just turned on closed captioning. So if you need that, it should be rolling across your screen, either at the top or the bottom, so that you are able to see the closed captioning as well. All right, so there are 158 people on here currently, with others joining. And I kind of would like to see a little bit about who all of you are. So I've got a few polls, they shouldn't take long. And I'm going to launch the first one, just what your role right now is best described as. For those of you asking about recording, it is being recorded. All right, so we have administrators, we have a fair number of social workers and school counselors, school psychologists, and other. Okay. So here's the results. Okay. And now I want to know whether or not your district or charter school or consortium has had the grant before. So if you've had the mental health grant before. So we have a fair number that have. This is helpful for me. So here's the results. Okay, now I want to know how you feel about writing the grant. So if you've never written the school-based mental health grant before, or if you have done so. Okay, so we have a number of people that are new to writing the grant, which is also very helpful to me. And my final question, how would you best describe your current school-based mental health program? All right, excellent. And I'll share these results. So we've got the majority of people have some solid pieces in place. We have some that are just getting started and some that are in sustainability. And one of the things I just want to be really clear about with this question is this grant is not only for any one of these. This grant can be used for any of these positions that you're currently in. Let's just be clear about that. Okay. So to get started, this is our agenda. We're going to look at the program, the overview, the authority for it, where it comes from, some important dates for you to know about this grant application process. Requirements, if you get chosen as a grantee, what are the requirements for that? You might want to know what that is before you apply. What grant expenses are allowable, what are not, how the funds can be used. That's usually one of the biggest questions. Some help in completing the application materials. For those of you that have done this grant before, have written this grant before, this is a new application. We're going to talk about that. How to use the WiseHive portal. This application process is now entirely online through WiseHive. That is the only way that grants will be accepted and reviewed, and we'll talk some more detail about that. How the applications are reviewed and the decisions are made about the grantees. Some just general grant writing recommendations. Many of you are new to this, and there's just a few things that I think are pretty helpful. How you can access technical assistance and consultation, and then who your school-based mental health grant staff are, and then just a few odds and ends at the end. So the mental health grant is officially called the School-Based Mental Health Services Grant. And like all of our state grants, it comes into being as part of a legislative process. So this grant is outlined, is authorized through the Wisconsin Statute 115.367. And in that legislation that was passed in 2018, it provided for funds for a competitive grant that goes to school districts or independent charter schools or consortiums of those to collaborate with community mental health agencies to provide mental health services to pupils. Now we're going to talk more about what that collaboration means. It is not one size fits all. We'll talk about different ways that grantees have been doing that, but you do need to have a community mental health partner. The grant awards are anywhere from $10,000 to $75,000. In this particular grant, you get to request the amount that you believe you need to work on your plan. And the funding is for 2 years. So if you requested $75,000, you would get $75,000 in the first year, and you would get $75,000 in the second year. You are not able to request a different amount for the second year. The current appropriation is $6.5 million. Now, one of the questions I'm asked often is this grant going to go away, particularly since we all know that there are some budget challenges in the state as a result of this pandemic. The statute provides for this grant. In order to get rid of it, it would require a legislative process to do so, which would be somewhat more complex. It could happen, but we don't anticipate that they would completely remove this grant program. What does change, and what has, is the appropriation. So when this grant was first authorized, it had $3.25 million. The last competition, the legislature increased to $6.5 million. Until the budget is settled and signed, we don't know what the appropriation is. We are going to go on the assumption that we are going to receive the same amount, $6.5 million. It could be more and it could be less, but we won't know that until the budget process is finished. So the grant period that we're looking at, I mentioned it's a 2-year grant, will go through the fiscal years of July 1, 2021 through June 30th of 2023. The grant application that you will be submitting is only for the first year. So your plan and your budget that you submit are only for year 1. If you do become a grantee, if you do win a grant award, you will be asked at the end of year 1 to submit your budget and plan for year 2. You're not reapplying for the grant, but we're only approving and looking at budgets and plans 1 year at a time. The grant awards are also issued, which gives you the authorization to spend the funds by year, not by 2-year segments. As I mentioned, this requires a community mental health provider partner. You will be required to submit an MOU or some other signed agreement that you have. You might already have a partner, and this is just a formalized way of showing us that you have it. I'm going to talk a minute in about different ways that you will work with that partner. or that you can work with that partner, but we have to see that you have a community mental health provider partner in order to be considered for the grant. That's not our determination, that's in state statute. But if you're having difficulties locating one, we certainly can talk to you about what other folks have done and the way you might work with partners that don't necessarily live in your area. But there needs to be a mental health community mental health provider partner. So what is that community mental health provider? This is the definition. So this is somebody that is licensed. Generally, they are agencies, but it could be individual therapists based upon, rural communities might have some individual therapists that have their own practice, but they do need to be licensed to provide treatment services. Now, this does not mean, and this is the question I get a lot, does this mean that we have to have a clinic in our school or our district? That is not what this is saying at all. A number of grants that we have done, as well as information coming from the federal government and best practices, school-based mental health is much more successful when it's done in collaboration with the community. Our districts that have really succeeded at this have done so because they have coalitions with their community stakeholders, which include community providers, in order to provide mental health services that are comprehensive and span from universal strategies all the way through treatment strategies. This grant is not targeted just at treatment. And in fact, I will tell you that the majority of the funding is going towards working with providers to create universal supports for kids. So different roles that our grantees in the past have had for their community mental health providers. This funding can pay for staff to come in and do co-led groups. Your providers cannot, by law, because of licensing requirements, come in and work directly with your kids to do things that your school-based, school counselors, school psychologists, school social workers would do, which are groups, right? So your school-based mental health providers, it would be their role to provide groups. But your community mental health provider partner can come in and do co-led groups, and they can be paid for their time to do that. You can pay for time for meetings with them as well, to collaborate with you on the plan, and to do reviews of the plan and to work on different aspects of the plan. Other grantees have used them to come in and do training with staff and parents around mental health literacy, how to support your child's mental health during the pandemic, for example. Some of them are contracted to do screening, and some of them are also paid to come in and do consultation, which is something that is not an easily billable activity through third-party insurance. So if you have a student that's receiving treatment and you want them to come in and do some consultation with the team on how to best support that student, you can pay for their time to do that. So the way that you use this provider really is based upon your local needs, who's available, the time that they have available. You just need to have a partner that's a community mental health treatment provider who is working with you to craft a comprehensive school-based mental health system. Before we go into that, Liz, were there any questions about this part specifically?
Nope, nothing yet.
Okay. So here are some important dates. So you all have access currently to the grant materials. The applications will need to be submitted by 11:59 p.m. on May 3rd. Some materials had said May 1st, that's a Saturday, so we thought we'd give you a couple extra days so that you don't have to submit it on the weekend. So May 3rd is a Monday, that's when the applications are due. We will not accept for review any that are submitted after that. This is a competitive grant, we have to set some parameters, so grants need to be submitted through the WiseHive portal by that time. Now, the following dates are what we're anticipating or what we're shooting for. Keep in mind that, and you guys have all been through this year, that the best laid plans can be modified, might need to be modified based on the pandemic and other things happening, but our plan is to get external reviews completed by mid-June. And I'll explain the external review process. The internal review process completed by the end of June so that we can announce the grant awards in July. Now, when we announce these grant awards and make these decisions really is contingent, it's absolutely contingent on the budget being passed. We have to know how much money we actually have to award Just so that you're aware, the entire amount that is allocated for this goes back out to schools. None of it is retained. But we can't make decisions about who's going to be a grantee till we know what the amount is for sure. And sometimes that goes longer than it's expected. So if we don't know who that is until July, it might delay things for us announcing grantees. Know though that if you are a grantee and you get your funding, say in September, you can backdate your funding to July 1, which is the start of the year. For grant activities that occurred over the summer, you can submit reimbursement for those. So if you're a grantee and we're going late, we'll talk about that. That's not something you need to remember, but I know somebody would probably ask that. The slides will be accompany the recording on the website. So here are just some requirements. We talked about the community mental health provider. That's the acronym. You know how we love acronyms. Grant, you will need to identify a grant coordinator. That's going to ask for that contact on the front page. The grant coordinator is the person that myself and the school-based mental health grant team will be connecting with. That's the person who will receive information from us, that will submit reports and things like that. You're required to follow all licensing statutes. I add this because there's a lot of questions coming in regarding mental health professionals that are licensed not by DPI but by the state, and whether or not they can be hired by you and using grant funds to do that. There's a link there that gives you some guidance from both our Student Services and Prevention and Wellness team and the licensing department about what those statutes are around mental health providers at DPI licensing. You also will need to complete all necessary reports. So in both years of the grant, there is an end of the year report in June, which will be submitted in 2022 and 2023. If you receive the grant, you will be asked to complete a renewal process in June of 2022, which is what we'll submit. You will submit the plan and budget for the second year. I'll talk about the data, but at the end of the year report, there is data that is required to be submitted. Now, just to be clear, if you've already gone in there, you'll see, and we'll talk about this as we go through each of the pieces of the application, that you have to talk about your data plan. We are not collecting data on how well or how much you've reached those goals. We are collecting data on the data points I'm going to share with you momentarily. So it's not a really high level, heavy duty data report that you have to provide for us, but there is some required data that we need. And these are the 5 things that we are going to ask you to track. Now, for those of you on the call, and I recognize a lot of your names that have done this with us before, you'll notice that there are more data points here. In the past, we collected 2. This particular state statute that authorizes this grant does not indicate what sort of data needs to be collected. It also does not require us to submit a report to the state legislature like our AODA grant does. However, we know that we need to collect data so that we can make the case to continue this grant and to include when we want to ask for increases in funding. So if you receive the grant, you'll receive also a spreadsheet where you can just enter these numbers in where we can find it. And the end of the year report may ask you just for these totals. You may not change or develop any policies during this grant, in which case it would be 0. But I just want you to see the data that we would be asking you to collect and submit to us. And if you're a grantee, when we get started at the beginning of the year, we'll do a webinar where we'll walk you through this. So I share that because I don't want you to think that once you get the grant, you're on your own. We will support that. Any questions about the data?
The question is about number 3. Mental health contacts made with school-based mental health providers. My understanding would be school-based mental health providers would be licensed therapists in the school, or is this a pupil services?
Pupil services, that's a good question. So that one is similar to the number that you've been collecting this time, except we were asking you to collect the number of students, which got confusing. So this would be your school social worker, school psychologist, school counselor, keeping track of the number of school-based mental health contacts they have. And we give you a lot of leeway to define that. So for example, as a school psychologist, a student might show up at my door and just be really frustrated because they had an argument with a teacher. That might not be counted so much as a mental health contact as the student that shows up because they're feeling really depressed. So at the beginning, you're just going to have your pupil services folks have a discussion about what you're counting, and then you count it.
So Beth, we've got a couple other questions about policies. So could you give an example of a school policy that would have been or should be developed as a result of this grant?
Yeah, and I think in Wisconsin, it's really hard to talk about policies sometimes because we think of them as big P policies. But maybe as you're doing your mental health work, you recognize that you don't have a referral pathway developed. And you develop a referral pathway, and now all students who need access to mental health services, whether they are school-based or community-based, need to be entered through a referral pathway. That would be a policy. So we're not talking about the big policies. It might be, some folks might, as a result of working with this grant, and may have identified that their LGBT kids are experiencing more anxiety and depression as a result of stigma. And you may create some kind of policy around that that becomes a board policy. But these aren't just board policies. These are things that you're going to change where you're expecting people to follow a particular policy or procedure. So the question about definition of a student service mental health encounter, again, that's where I said we're leaving some leeway up to you. I think some of this is professional judgment. The thing about these numbers is we're not going to use these to make any sort of analysis. So if your district is counting one thing and another district is counting another, it doesn't really matter so much. It's going to be more around what you have identified as a mental health contact with a school counselor, school social worker, school psychologist. In the past, we were just trying to count individual students, and that got confusing because if a counselor and a social worker saw the same kid, we only wanted them counted once, and I think that people weren't able to track that. But as a school psychologist, I could just, and that was my background, which is why I keep referring to that, I would just keep track of the number of kids that came to me for something that our team had identified as a mental health contact.
Okay, and then one other question. So just generally, someone is wondering, is this to fund a school-based mental health person like a school social worker, psych, or counselor, and not a community mental health clinic partnership?
So that's actually a good segue because I haven't started talking about expenses yet. So I think that question will be answered when we start talking about the expenses.
Great.
Any other questions about data? And I guess I'm just going to ask you to recognize that these are the data points. We're not expecting a heavy lift for these. And once we've identified grantees, we will work with you to better develop them. And I think it's also helpful to know that we collect this just because we want to make a good case for this grant. So if somebody says, well, why should we fund you more money? We could say, because through this grant, this number of students received mental health services from their school-based people, and this number of students were referred, and this number of students who were referred actually got treatment. As I mentioned before, the data will be collected at the end of your report. Okay, so grant expenses. So there are a lot of things in this grant that you can fund that don't always get funded by other projects, but there are some things that you can't, and then there are some things that you can fund judiciously. So all of your expenses, whatever you put in here, and for those of you that have had the grant before, you've heard me say this, they have to be related to your school-based mental health project in your plan. So you can't add a position in here that has nothing to do with the grant project. You also have to make sure that all the items that are in your budget can be found in the plan. And I will show you an example of what I mean by that. But I'll quite literally take your budget when we're in the internal process. And if you've got somebody in there that you're paying for a contracted service to do a training, we need to see them in the plan. Grant funds are to supplement, not supplant. And for those of you that have been familiar with federal grants, you've heard this language before, but essentially the definition is on the bottom there. So you can't use these funds for the cost of activities if the cost of those activities would have otherwise been paid with state or local funds in the absence of the grant program. So for example, you can't use these funds to pay for a social worker that you've been paying for, unless that social worker is now taking on additional responsibilities specific to the grant. So allowable expenses under personnel. Now, those of you that are familiar with the budget form will notice that these are the categories, summary categories in our budget form. You can pay people to do the work of the grant. So this is one of the things that not all grants will allow you to do. And it also, given that there is $10,000 to $75,000, that gives you the room to actually pay for personnel to do the job. So what does this mean? This means that you can use this funding to pay salaries for staff who might be attending training outside of their regular paid time. So if they're attending after school or weekends, you can pay salaries. It means that you can pay for subs if you're bringing substitutes in and pulling teachers out during the day for training. It means you can pay a grant coordinator or other support people who might be doing direct grant work. So for example, we had one grantee that used funds to pay for part of a school counselor position. The counselor had been part-time. They boosted that position using grant funds, and then the role of that counselor was to be staying connected to students and following up with those students who had received treatment services with the community providers. That was written into the plan. So if you are paying for positions, those people need to be showing up in your plan as responsible for some of the actions in the plan. If not, they can't be funded. It can pay for purchase services. So I mentioned your community mental health provider might be coming in to do consultation. It can pay for staff and parent training. It can pay for in-state conferences, and you can now do out-of-state conferences as long as they're virtual. Out-of-state conferences in which travel is involved are too expensive to justify for the funding because of the travel costs. So as long as it's virtual, you can do the out-of-state. It can pay for screening services. Some of our communities use an agency in their area. So for example, in the Fox Valley area is Y-Screen. It can pay for trainers or program consultants. Some people will be getting training from SEL curriculum provider or an SEL assessment provider, and you can do contracts through purchase services for that. There are some expenses that have limitations. So for example, motivational speakers or day retreat events, when we can actually get back to in-person, are limited to $1,000 a day. We're going to talk about non-capital objects. There's some that need to be limited and some that don't. I talked about out-of-state travel. Training certification. So if you need to get trained in a program and the only place that will do the training is in Massachusetts, you can use the funds to get there to do the training if you can't do it in Wisconsin. And then a new expense are the student and family assistance programs. And there's a link there to more details about this. So we've had some, this is new, we've had some districts that have worked with community providers to contract with them on a per pupil basis so that you would pay a certain amount per every student in your district. And then that provider agrees to provide up to a certain number of services to every student. The grant funds can pay for a portion of that. If you want more information about what these student and family assistance programs are, they're a lot like the employee assistance programs, you can click on that link and we'll be able to get more information about that. Now, this isn't something you can just jump into. It does require some planning, but it is a way to provide some equalized access to services for all kids. You can't use these grant funds to pay treatment costs. So if a provider is seeing a student and now they're going to bill for that treatment, they have to bill a third-party provider, a third-party insurer. But this is a way to provide services to all kids through a contracted agreement with the provider, where they're not then submitting through that insurer. There are some very particular requirements with it. So if you're thinking of something like that, please make sure that you're reading that information. So non-capital objects are the things that you need to do different types of work. So curriculum falls under this, books for treatment or books for book studies, materials to support curriculum. You might find office supplies that you need. Some of this also kind of, we lump it into non-caps, although sometimes it's capital. And we recognize in the past, our state grants through our team have usually required all non-capital objects to be limited to 10% of the total award. So if you get $75,000, you couldn't spend more than $7,500 on non-capital items. But we recognize that some of these are really important to mental health work and that they can be rather expensive. So what we kind of did, and this isn't an absolute black and white, but we've kind of looked at the materials that you don't have to cap at 10%. The ones that you do are often, but not always, the ones that are consumable. And there is another link you'll see here to more information. We also link to this document, another document in the guidance document that accompanies the grant to help you figure this out. But curriculum, evidence-based curriculum, if you're buying curriculum with the grant, it needs to be evidence-based. Character strong, if you're going to ask, does not yet meet that requirement. And evidence-based curriculum are ones that are found on a national registry. You can use the grant funds and not limit it to 10% of your total award for curriculum support materials like books, puppets, manipulatives that are not consumable. You can use it for screening forms and technology. You can use it for books, for staff development, teletherapy technology, and training materials. The non-cap things that are limited to 10% of your total award are things like office and training supplies, paper, markers, pens, consumable things such as coloring books, posters, and workbooks, furniture to update some spaces for confidentiality or treatment areas or small group areas. Some grantees have used their limited non-cap funds to create calm down spaces. Office equipment such as laptops and printers, retrofitting spaces to create confidential therapy spaces, food for training or parent events, and large mechanical items. So generally speaking, if you look at this list, the things that are limited to 10% are really things that don't have all that much impact on student outcomes for mental health. We want to make sure that percentages, large percentages of your grant money aren't going towards things that really don't have a whole lot of impact on the outcome. And these are the expenses that are not allowable. So you can't use the grant funds to pay for direct treatment services. You can't use the funds to do out-of-state in-person conferences because of the travel costs. You can't use the funds for non-mental health related training. So for example, PBIS is related, but it's not mental health necessarily. So we have not allowed these funds for PBIS Tier 1, Tier 2, or Tier 3 training. The state grants are not no longer allowing indirect costs or the costs of doing business. You can't use these for incentives to encourage people to attend events. So sometimes I'm asked if you could give gift cards to parents or teachers if they come to something. You can't use it for that. However, you can use gas cards to provide to parents to attend things because they may not be able to afford the gas to get there. You can use the funds to pay for childcare for parent events around mental health. You just can't use these as incentives as sort of like you come to our event and you can have this thing. You can't use this for programs that aren't evidence-based. You can't use it for salaries or wages for positions that are not doing grant work. And if you are using it for grant work, make sure that if you are, for example, deciding that you are going to pay a 0.5 position, that that person is really working 0.5 of their time for the grant. Because if you get audited, you'll have to show that that's the case. And again, about grant funds to supplement but not supplant. And then I just kind of took these different kinds of activities and got a little bit more specific about some of them and are showing you what they might look like in an MLSS. So our grantees under Universal have used this to support SEL training and materials, trauma-sensitive schools and resiliency training, suicide prevention, bully prevention, stigma reduction, mental health literacy for students and adults, family supports, community mental health collaboration, and I would also now include compassion resilience work for adults. Under selective, things like screening, co-led groups, wellness planning, mental health navigation, parent peer support, community mental health provider consultation, seamless referral and follow-up process, and then things in the targeted area, again, the navigation, wraparound services, telemental health, and seamless referral and process. Before I take questions after expenses, I also want to just address the mental health navigator position. Many of you may be aware that a number of districts in the grants have used funds to pay for a person as a mental health navigator. This is kind of a new school role, if you will. It's something that has been in the medical field for quite a while and in different community agencies. But in this case, the navigator is a role that is responsible for doing the liaison work between schools, community providers, and families. Generally speaking, this role doesn't work directly with students, but if it does, so in some cases, mental health navigators are the ones that are following up with parents about appointments, helping them navigate some of the challenges that they might be having in following up with a referral. They might be tracking the different referrals. They might be the person that's helping to keep track of those 5 data points that we're asking you to do. If they are not having contact with students, they do not require a DPI license. If, however, they are also engaged in doing group work or any other kind of work with students, they will need to be DPI licensed. You can use grant funds to pay this position, knowing full well that if you're using funds for positions, these are 2 years of funds, they're soft funds, but we believe that you're all capable of making the decision about whether you want to do that or not. And I would say about half of our grantees this last round used some of their funds to support mental health navigators. So Liz, I think a lot of questions are coming in around expenses.
Yeah, so one question is, if there's somebody who's already employed full-time, can they use this grant funding to pay them to work above and beyond that full-time position?
Yes, as long as the above and beyond full-time is grant-related work. But you can't use the funding, for example, to pay a school psychologist to do IEPs and school psychology related work like that. It needs to be connected to your grant.
Okay, and then if you bring in training for staff, not a motivational speaker, but a trainer in curriculum or something else, can those costs exceed $1,000 per day?
Yes, absolutely. And in fact, generally what happens is the grantees will do a contract with that provider of the training for whatever the cost that is. And we recognize sometimes that's expensive. So that's not limited to 1,000. The motivational speakers are usually like a one and done kind of thing, which is why they're limited, because we feel like a one and done, or even sometimes these events where people come in and do a one-day thing with students, they're really a great feel-good thing for a while, but there's not always a lot that happens as a result of those. Training has much greater outcomes, so those are not limited to $1,000 a day.
Okay. And then in terms of documenting time spent to justify funding for a particular position, Do you have any thoughts on the best way to do that?
You know, I think that really has a lot to do with the way that your own district would manage that time. It might be beneficial to talk to your business office. So we don't monitor it, right? So if you're telling me that you're paying a 0.5 position for a particular person to do a job in the grant, I'm going to take your word for it. But if you're audited, you just need to be able to show that that person actually did that work. And I would guess that every district has some process that they do that, because everybody, business offices would probably be the best place to start to ask, because they know what an audit would ask. My short answer is no. I would refer you back to your district.
Okay, and so if there's someone working in a position that's currently full-time, but it would have been reduced to part-time, can the funds be used to bring that position back to full-time?
If they're doing grant work, they need to be written into the plan. Now, when we get into the plan, one of the things I really want to caution you about, though, is not to write a plan around a person. You're going to want to write your plan around the gaps that you've identified in your comprehensive school-based mental health services. But if you've laid somebody off part-time and you see a role for them in the grant project, it most certainly can. So just keep in mind, it has to be connected to the grant work. But we need people to do the work, which is why this grant will fund people to do the work.
Okay, that looks like all we've got right now.
Okay. Yeah, and I will just say that I think that, you know, a lot of the grants, particularly if they've requested and received a higher amount, they're using a fair amount to pay for positions. And there's no problem with that, because you really do need the people to do the work. So I don't want you to feel like we are discouraging that. We're not at all. I just want to make sure that you are connecting that position to your plan so that it can be funded. Because if we can't see it in your plan, we can't approve the funding for it. And we'll get into some more detail about that. So just a bit about the grant materials. So on the website, I'm guessing many of you have already been there, but there's a link to it on this slide. And on there, you will see a needs assessment and resource mapping webinar. You'll see a frequently asked questions document. You'll see the grant guidance document. You'll see the link to the application portal, which I've also included on this slide. And you'll see a PDF of grant application. And that PDF of the grant application, I can't stress this enough, is only for reference only. We felt like maybe you'd like to see the whole thing, because when you're in the Wise Hive portal, you're just getting a section at a time. So that PDF is helpful to see the whole thing. It's also helpful if you want to upload it so that people can, like into Google. PDFs don't always go into Google well, but you could load it into Google so that people could work on it together. And then the person who's working in the portal can just copy and paste into the portal. But we will not accept a PDF version of the application. And it seems to me, maybe if you guys don't mind, I'm just going to pop out of this for a minute. And I'm going to pop the link for the slides into the chat, because I realize that I didn't do that. So there you can access the slides if you want to see them in real time. So my plan is to kind of walk you through some of this a little bit so you know what these are. So the application portal, again, I have a link on this slide. We put it in a couple different places, the PDF talking about that just for your reference purposes. And then the grant application has a number of different sections. And so this is new. This is a new application. Our agency has decided that we were going to go with a uniform grant application and process. So if you do any application for a grant with DPI, that the application will be pretty much the same. There are examples and things in the application that we can modify for the particular project, but trying to create some uniformity to make it less confusing. So there's a general information section, which is asking you to fill in all the contact information and things like that. I'm just going to say, double check that you've got your emails in there correctly, because if they're not, we can't contact you. The overview, you don't complete this section. The abstract is brief. Again, if you're new at writing grants, there is a tendency to think that this abstract needs to be really detailed. It's a brief summary of your project. And I really recommend that you write the abstract last, that you go through your whole process, create your plan, and then you can do a really succinct summary. This section in your application is character protected, so it's only going to allow you to do a certain amount of space. So your abstract needs to be just a short summary of your proposed 2-year project. The certification and signatures, you can do this online in the portal. So in this case, you're not going to need to upload anything for these signatures. There's a process by which in the portal you can send a request through an email process to somebody to do a required signature. The same for the consortium. Now for consortium, if you are a number of districts going in on the grant together, you still can only maximally request $75,000, not $75,000 per district in the consortium. And if you are doing the consortium, all district administrators in the districts that are part of that consortium have to sign off in this consortium verification. This can be done online as well through this request process. Trying to make this as simple as possible for you. We just need to make sure that all of the district administrators are aware and support that you're applying for this grant. So the seventh session is the plan. And this is where you start to identify the needs that will be addressed. And section 8 is your action plan, where you start to provide the detailed goals. Now I'm going to go into some more detail about these because there's some new language in them. But essentially in the plan, this is where you're connecting the needs assessment and what you're identifying are your gaps so that you can create a plan to address those gaps. The detailed action plan is going to include your goals and objectives, your action steps. It's going to also include who's responsible for those action steps and some timelines. Keep in mind that this plan that you submit with these timelines and your goals and your objectives, this stuff, the outcomes of these things are not reported to us. We're going to ask you what you're spending the money on in that end of the year report. We're going to ask you for your summary of your project, and we're going to ask you about those 5 data points. But whether or not you actually met an objective is not something you're going to have to report to us. Section 9, study check, is going to be where you describe the evaluation process that you're going to take internally to do this. Again, this evaluation process is how you're going to be studying, checking, continually improving your process. This is not information. Once you tell us how you're going to do it, you won't be responsible for submitting a data report based on that evaluation plan. Then act, how you're going to coordinate with other programs and your plan for sustainability. One of the things we really hope that you will do in this project, and we can help you through consultation and technical assistance, is align your comprehensive school-based mental health with other programs and initiatives that you're doing so that this is all working together for the same outcomes as opposed to being seen as different programs and different initiatives. Then there's a section on readiness where we're looking at who you have identified as your stakeholders and how you're going to communicate with them about the project and the plan.
Hey Beth, could you paste the link again to the slide? Some people aren't seeing it.
Oh, that's because I keep sending it to one person who last messaged me. Sorry, Marcy. Can you see it now?
Yes, we can. Thank you.
Okay. Were there any other questions?
Yes, one question. Can the mental health navigator, who is a licensed therapist but does not have a DPI license, co-run groups with the school counselor or other school
They
staff?
can co-lead them, but they can't do them on their own. Okay. So needs assessment. I think there's a couple things that I just want to point out about the needs assessment. I think oftentimes when we do these grant applications and we're asked to identify needs and do an assessment and thinking about the tools, that we are doing this so that we can prove we have a need. I think in some cases that's true. In this case, it's not. Every applicant that sends in their application for review has school-based mental health needs, every one of them. So this isn't a competition who's got greater needs. What I'd like you to think about this section, I'd like you to think that this section's utility is in helping you identify the elements of your plan. So your needs assessment should be more internally directed rather than trying to prove something to reviewers. And using that needs assessment to identify where there are gaps in the services that you do or want to provide. The other thing is to consider the data sources. It's information that you have. I think that I've been getting a number of questions. People are relying a lot on the Youth Risk Behavior Survey, and that is a great tool, but particularly right now, if you've been doing it, you're probably not going to have data that's very new. That's okay. If you don't do the YRBS, that's okay too. So you can use things like focus groups with parents or students. You can use surveys. You can use your climate surveys. I'd also encourage you to look at your needs assessment in terms of assessing your system. If you are looking at doing comprehensive mental health, the needs are not just about the fact that your students are expressing higher levels of anxiety than they were 2 years ago. Your assessment is also looking at whether or not you have systems in place to manage a school-based mental health, comprehensive school-based mental health program. And if you're looking for a way to assess that, there's a link on here to the Wisconsin Mental Health Needs Assessment, which will help you do that. That's really looking at the different systems things that are in place. So your data sources can include process data. It's a very important data point to say, we don't have any consistent referral process or pathway for our students. Sometimes kids know where to go, sometimes parents know where to go, sometimes a referral is made and nobody's followed up on it, but we have no consistent process. That's good data. That's indicating a gap in one of your systems. I mentioned it could be surveys. It can also be student to provider ratios. So you might be recognizing that you don't have enough providers, either your school-based providers or community mental health providers, to address the needs. Another really, really good data source is county health rankings. And if you just do a Google search for Wisconsin County Health Rankings, you can find information about your county. There are a lot of counties in the state of Wisconsin that have ratios of individuals to regular community mental health providers that are horrible. That's a good data point. It could be anecdotal evidence. It could be the YRBS. It could be that you've been working on screening already and you have some screening tools and you recognize that, you know, we've been screening for this, but we're getting indications that we've been missing screening in this area. So you can be very broad about what data sources you're using, but use whatever data sources you have that can help you identify where your gaps are and then help you to create the plan. So when the reviewers are looking at your needs assessment section, I want to be really clear about this. They're going to be looking at it to make sure that the plan that you submit is connected to this needs assessment. One of the things that gets applicants to score low is that a needs assessment will be done and they'll report what they identify in that needs assessment. So say, for example, they recognize that through their needs assessment that they've got high rates of depression and anxiety, but then they never address it in their plan. So this is where the reviewers are looking to make sure that your plan is connected to the data that you used and the outcomes, the gaps that you found. So this is some new language. I listed as grant application glossary, but if you've done the needs assessment webinar, it's very short. And if you haven't, I encourage you to take a look at that because it'll help you create a needs assessment and resource map to begin the work and help you actually develop these statements that I'm going to go through. So in the grant now, the student outcome priority statement is one of the first things you're asked to do. And essentially, this is what you do as a result of your needs assessment. It's a summary statement of what your needs assessment identified as priority areas for your project. Nothing more than that. So I gave 2 examples. So based on 2019 YRBS data, 28% of students report they are sad or depressed, 31% report being bullied at school during the last 30 days. LGBT students reported higher levels of sadness and bullying. So essentially what you're doing is just summary statements about the data from the needs assessment. If you're not using YRBS, it might be review of district school-based mental health systems show that there's no clear referral pathway in place to ensure students can access treatment services. So it's just a simple statement that summarizes the needs and gaps that you found. Once you do that statement, then you need to do a root cause analysis. Many of you are probably hearing this term everywhere, but you've identified what that need is based on your data. And now you do a root cause analysis of the factors that you think are contributing to it. Now, keeping in mind that your root cause analysis you may find out as you start to roll with the activities that wasn't really accurate and you can make some modifications. But right now, what does the information you have tell you is the root cause of that gap? So for the previous one about the students with anxiety and depression, they don't know how to advocate for themselves or seek help when they experience a mental health challenge and experience stigma often associated when asking for help. LGBT students are experiencing more bullying due to environments that are normalizing homophobic bullying. Or the one about the referral pathway, there's no clear communication or coordination for referrals to community mental health providers between the elementary, middle, and high school. So your root cause is just going to demonstrate to the reviewer that you spent some time thinking about why the data that you got, that summary of that data that you got, why you think you got that. The root cause is also going to help you start to identify the activities that you're going to put in your plan. So it will all be connected. And then the application is going to ask you for a practice priority statement. And the practice priority statement is really just telling the reviewer generally, this isn't a SMART goal, but generally what the outcome is that you hope to achieve by doing certain things. And in this case, we're asking you to use a particular sentence stem. We believe we can blank if we blank. We believe we can reduce the percentage of students who report feeling sad and depressed and bullied if we create environments that support adult and student connection, provide students with mental health literacy skills, and empower youth to lead peer initiatives to increase tolerance and reduce stigma. You'll notice that the section that comes in the if we, after the if we, is actually really connected to that root cause analysis. Another example, we believe we can increase the number of students who access mental health treatment services if we develop a coordinated referral process across all school sites. Questions about those three before I go into the action plan?
Nothing in the chat.
Okay. So when you get into the action plans section, each student outcome priority statement. Now this is the general statement of your data, right? So let me go back so that we don't get confused. For every one of these student outcome priority statements, you will need to create at least one SMART goal. And then each SMART goal is going to require the action steps, the timeline, evidence of completion, and the personnel that are responsible. Your priority statement might have more than one SMART goal. You certainly can do that. The portal will allow you to do 2 SMART goals per student outcome priority statement. You may have more than one student outcome priority statement. Each SMART goal will allow you to have up to 7 action steps. So keep in mind that there are some limits to this based on the portal and also to try to limit the length of these applications. So for every outcome priority statement, you will create at least one SMART goal. That statement might lend itself to 2 SMART goals. For each SMART goal, you will create an action plan with steps, timeline, evidence of completion. And for each of those SMART goals, you can have a total of up to 7 action steps. You may end up, if you need more than 7, kind of blending some steps together. So essentially what you're doing is you're doing a needs assessment that results in a student outcome priority statement. That student outcome priority statement results in a practice priority statement, which is very generally saying what you expect to achieve when you do certain things. And as a result of that, you're creating SMART goals. The action plan is related to their SMART goals, and in that action plan are your grant action steps. Any questions about the practice priority statements, the action plan, any of that? Good, Liz?
Yeah, so quick question. Can the needs assessment focus on a specific school within a district, or should it be more of a district-wide picture of what's going on?
That's a great question. Depends on what you want to do with your grant funds. So keep in mind that your needs assessment is resulting in the plan. And so for some big districts, we have some grantees that in some districts are just deciding to focus the grant on the high school. And then we have some districts that are looking to do that district-wide. So it really depends on what you want to use the data for. It's not, or the grant for. It's not required to be whole district. That's up to you to decide. And I would also say that if you are doing whole district, you don't have to have the same SMART goals. So for example, you might have a SMART goal at the high school level for one of your priority statements, and then a SMART goal at the elementary, because you might be doing identify completely different needs. So at the elementary school, you might be looking at doing universal SEL, and then at the high school, you might be looking at doing sources of strength or Hope Squad. So you can do both. You don't have to have the same activities at both levels. And Sondra, you can use the YRBS data from 2019 if you like. And Liz shared a link to the SHAPE system, which is another really great tool to assess your system for comprehensive school-based mental health. Okay. Any other questions? Jennifer, I see yours. I'm just not able to answer right now. Okay. So just some general application recommendations. There's a lot of you that are new to writing the grant. I really encourage you to do the needs and resource assessment prior to completing it. That will get you set up to write it. And I also want to stress that I don't want people getting stressed out over the needs and resource assessment. Figure out what data you have. My guess is that the majority of you have some hunches about where your gaps are in your programming. And then if that's the case, and you know that there are certain things that's kind of anecdotal, what data do you have to support that? I also encourage you to do local data. We've had grantees in the past that would put information in there about the percentage of kids that were experiencing depression and suicide in the United States and in the state of Wisconsin, but then nothing about local. If you don't have that data for local, don't give it for the state or the national, use local data. Our ratios for school-based mental health providers to our students are inadequate and do not meet the national recommendations. Or student climate surveys indicate that students are feeling that bullying and being unsafe in school at a higher rate than they did 2 years ago. You might have some data around the pandemic. Many districts have done some surveys with students and families around needs for the pandemic. You might decide to use that. Be as specific and clear about your plan as possible. Reviewers aren't going to be able to infer what you're talking about. And I think this is true of any writing. It's a good idea to have somebody that hasn't been involved in the project read it and make sure that you're being clear. Check for clarity. Because as you read it, you know what you intend, and we often see what we intend in what we write, and somebody who's not involved might miss it. So your job as the grant writer is to try to make your application stand out. This is a competitive grant. And the way that you're going to make your application stand out is by writing a really clear, specific plan that's tied to the gaps and the needs that you've identified in your needs assessment, and that doesn't leave reviewers guessing, and also looks like a good use of the funds. The other thing I would really recommend is before you submit anything, before you hit somebody to review the application before submitting it. They can check for spelling errors, they can check for things that aren't clear, they can make sure that you've included something that might have missed. It's really a good idea to have somebody who didn't help write it review it. So as I mentioned in your plan, these are the requirements. All the activities that you put in that plan that you are going to fund with it have to be allowable. So go back to those expenses. All items that are funded must be in the plan. I'll show you what that looks like. Positions funded with the grant must be found and identified as the personnel responsible for some aspect of that plan. And purchased services providers must also be found in the plan as responsible. So in the past, for example, we had people that were going to fund St. A's for TSS training, and yet St. A's and TSS training never came up in the plan. It has to be there in order to be funded. Okay, so the budget. This gets a little confusing for people, so I really encourage you to work with your business office as you're writing up this budget and itemizing the grant project budget for the submission. They are going to understand the Woofer codes and all those kinds of things that we get questions about, and where different activities or salaries or which ones of these different categories they should go in. Really utilize your business office for that help. The budget that you submit for this grant application is only for 2021-22. So July 1, 2021 to June 30, 2022. If you are awarded the grant, you will submit another budget in June of 2022 for the next fiscal year. And make sure that your budget summary sheet is complete. Now, in the WiseHive portal, it's pretty much forcing you to complete things before it lets you close out, but double check your numbers. So we've had people that requested a certain amount on the front of the application, and then the total amount in the budget didn't match. Sometimes you will not add everything up or get things tallied. Make sure that your budget is tallied and that it's complete when you submit it. Once you submit everything, you can't modify it. So if we come across some errors in there, we can't ask you to correct it. So just double check and make sure that it's all aligned and everything is working right and it looks correct before you submit it. So this is where I was talking about seeing if something was in line. This is an example from a previous grantee. In their plan over here, you see it says provide transportation services and language interpreting services for students, families to access mental health services. This is in the plan. Over here, it's in the budget, where it's got the name of the person doing it is not known yet, but it's for the interpreter. The interpreter was in the plan. I can find it in the budget. That's allowable. Over here, there is a mental health navigator. In this case, it's a 0.5 position, and I can go into the plan and see that the mental health navigator is responsible for all of these jobs connected to the grant plan. So if it is in the budget, I have to see it in the plan. The internal review people have to see it in the plan in order to approve it. Here's another example where they have a collaborative partnership with their community mental health provider for mental health training, co-lead groups, and consultations. So you notice there's 3 things in there that they're paying to their community mental health provider. It's showing up in here under mental health training, community mental health provider, speakers, groups, consultation. Here they've got travel expenses for school van. Over here in the plan, they talk about how they're going to pay for transportation for students to get to and from services. So if it's over here in the budget, make sure that it's in the plan. I think this is also helpful for you to see how things get listed in the budget. Okay, before we go into Wise Hive, Liz, questions?
Yes, if more is accomplished in the first year, can the plan and budget be adjusted accordingly for year 2 if one gets the grant?
Great question. Yes, it can. And you can even make modifications during the year. We ask you to wait a while because, you know, if you got awarded this grant on your plan, we don't want you to completely change the plan. But as you can imagine, this last year, grantees had to make all kinds of modifications. So you're allowed to do that throughout the grant award time, those 2 years. And then you certainly can make some modifications in year 2.
Great. If there were, if PD was happening in your plan, would it be able to take place in August of 2021, or would you need to wait until the 2021-2022 school year?
So because the fiscal year and the grant fiscal year begins on July 1 of 2021, you conceivably could use the funding for summer trainings. If you don't know whether you're awarded the grant or not, so say we're still waiting to hear, we've had times where the budget doesn't get approved and everything ready to go, and we can actually notify, because there's a whole internal process too. We may not notify you till August, and if you decide to do training in July and you don't get awarded the grant, then you're obviously responsible for those costs. If you know, you certainly can use it for those summer expenses, and those expenses can be reimbursed back to July 1 of 2021. Anything else?
Nope, I think we're ready to move on to Wise Hive.
Okay. So we're recommending Google Chrome for optimal performance. It'll work best in Google Chrome. You will need to create a profile to access the system, and only one person can do that. So if there are a group of you writing this grant together, and that's exactly what we encourage you to do, identify one person to be the portal person. I just made that up, the portal person. That's kind of cool. And the portal person will be the one that is going to take the work that you do and put it into the system. You do not have to complete the application in one setting. And I think, Danny, that was one of the questions that you had. You can save your work. So as you're going through each section, you know, in this picture here, hopefully you can see this, that each section you would start, you can save your draft. At the bottom of the application is an option to save your draft. And then when you go back in, you can go back to where you'd stopped. You can navigate between sections, but you'll always need to return to the application page to do that. When a section is complete, you'll mark it as complete, and it's not going to be showing up as complete in your application until you do that. To submit it, you will have to click submit. It's not going to let you submit the application unless you've marked all sections complete. This is one of the ways that it's forcing you to make sure that you do all sections. However, you might mark something complete that isn't, so I really encourage you to go back and make sure that everything you've marked complete is in fact complete. And once everything is marked complete and you hit submit, you won't be able to do any changes once you've submitted it. So before you hit that, it should also be a big red blinking button, submit, just to make sure that you have got everything in there like you want it before you hit submit. If you do hit submit and you see action required, it means that an item that was identified with the asterisk is not completed. So it will guide you back to finishing something before you submit. As I said, you can edit this application any point up to submission, but once you submit, you can't do that. We talked about signatures being done in the portal system by issuing a request, and then you will need to upload your MOU or your letter of support from your community mental health provider so that we know that you indeed have a partner. The Wise Hive portal is available at the links throughout this and on the webpage. Yes, you'll request those signatures before submitting. Now, they may come in after, but you'll request those signatures as part of the process as you're going through. Any other questions on Wise Hive?
Just confirming that it's available now to create accounts.
Absolutely, yep. Okay, application review process. So for those of you that did this before, it's very similar in that you will have an external review. 3 people will review the application, and then it will be, the scores between the 3 people will be averaged. On the right, you see a picture of the rubric that is used to score. So you can see this right away. Also in the guidance document for each section of the application, it gives you an example of what a full 4, for example, would be for that section. So there's a lot of help to guide you to writing this in a way that will best meet these rubric pieces. The action plan is weighted by 2, so that one gets weighted more than any of the other sections. Each applicant will be scored by those reviewers. They are going to score everything but the budget section. Those will be averaged. And then what will happen is that final score will be created for you, and then all of the applicants rated on that score. Essentially, what we will do then is identify how much funding we have to award, and then work our way through the ranked applications until we run out of money, essentially. Both times what we've done is the very last grantee that meets some of the funding for the allocation before it runs out. Oftentimes it's less than they requested, and we will, if you're that last grant application, we will reach out to you and say, you know, we have this amount of funding, but we aren't able to fund your entire project. Would you be willing to take it? That will be up to you. So you still have the ability to not do that if you don't feel that the amount that we can provide for you will be sufficient. So that's the external process. Once we have those ranked applications based on how much funding we have, so keep in mind, if we have 3.25, that's going to fund fewer applications than if we have 6.5. And if they actually, by some, in some way, give us more funding, we can increase some applications that way too. Once we know roughly the applicants that are above the threshold for funding, meaning these are the ones that we would, based on the first part of the review process, would fund, those applications go into the internal review process. And that's where the school-based mental health DPI consultants team will review the projects just to confirm the ratings, make sure that the applicant is indeed an eligible applicant, school-based, public school district, independent charter or consortium of those. We'll also look to make sure that budget items are fundable and are prescribed grant appropriation. We'll also make any budget modifications or revisions if there are non-allowable items in the plan. And then once that's all determined and we know who can be funded, we will submit the list of those recommended applications for funding to the state superintendent for approval. And then there's an internal approval process that has to happen. Now, for those of you that have done the grant before, one of the changes with the portal system, so the review process is also going to be online, is once the grant competition is over, you will be able to go into the portal and see your own rubrics. You won't have to request them from us any longer. All right, questions?
So just to backtrack a little bit, a question about the portal. If you have a consortium that's submitting an application, what's the process for how signature requests are sent to the various superintendents?
So when you get to that page in that portal on the application for the verification of signatures for the consortium people, you will be able to request, you'll hit request, and then you put in the email of who you're requesting the signature from, and then you will send that out to each of the district administrators you're requesting a signature from, they will reply to that email to verify the signature. So you don't have to get a signed copy and upload it, get a PDF, send it to us. It can all be done in the portal. Now, I will say this too about signatures. You know, if there's challenges with the signatures, and if, you know, we get to the internal review process and we notice that we're missing a signature, that isn't going to kick you out of the grant. You know, if you would be getting funded, that's not going to affect your funding. We'll work with you to get the necessary signatures. But the internal process with WiseHive allows you to request those through email so that you don't have to do any sort of paper PDFs and anything like that.
Great. And then another question, is the external review process blind, or do the reviewers know who the application is from?
The reviewers will see who the application is from. And part of why we do that is that prior to assigning applications to reviewers, we make sure that there are not any conflicts of interest. So we make sure that reviewers are not reviewing grants from their area, people that they've worked with, districts that they've worked in. If they're at a CISA, they're not reviewing any grants in their CISA. So we do a pretty intense process making sure that there is no conflicts of interest. Liz and I are not reviewing any grants so that we are available to do consultation and support so that we aren't at all influenced by any conversations we have with anybody, so we don't do any of the grant reviews ourselves.
Okay, and then if you have a consortium applying, do all of the parties that are part of the consortium have to have a signed MOU before they submit the grant?
The consortium just needs to have a community mental health provider partner. Now, if each of the districts in the consortium have one, you could submit them all. You don't have to. To meet the requirement, each grantee or applicant needs to have the community provider partner. Some districts, especially the ones that are doing consortium, are also small districts that are sharing the same agency anyway. So you would only need to submit one letter for a consortium. You could submit additional if you like.
Okay, that's all we've got in the chat for right now.
Okay. So over the course of doing these grants, writing some grants myself, there are some things that come up that are often common grant errors that really just, it's really sad because it sort of takes a grantee out of the, or an applicant out of the running. So make sure that all your sections are complete. So for example, in WiseHive, it's really going to force you to be more diligent about that because you have to mark something as complete. But it's entirely possible that you think you finished something, you left mid-sentence, hit complete, and never completed that section. Make sure that your sections are complete. Sometimes the information that you provide isn't what was requested. So really look at the question on the application, the section, what is being asked. If they're asking you about what your stakeholders are and how you're going to communicate with your stakeholders, don't start answering a question about something that's not related to that. Answer the questions that are asked. And I will even say, you might get a section where you think, God, I answered this already, or I did this before in the beginning summary part. Answer it again. The best advice I ever got from a director was answer what they're asking. No matter if it seems redundant or not, answer the question that they're asking. And I would encourage you to do the same. Make sure you're using as local data as you can. Make sure that your grant plan is based on your needs. Make sure that your budget items are all in the plan. Make sure that your budget tallies. And make sure that your grant plan includes activities that are mental health focused. So sometimes grant plans will include things that have nothing to do with mental health and reviewers don't see what the connection is. That affects the score. And I think when you look at that rubric, you get a pretty good sense of what we're looking for in the applications. So just some supports. This is, especially if you're new to this, I can imagine that this feels really overwhelming. I've been working at this for a number of years and creating these documents, and Seems easy for me to just throw this stuff out there, but if you're new at this, this is overwhelming. So we can't ask you to do a great project and do great work without also providing some kind of supports to you. So there's a number of ways that we do that. So if you have grant questions or about program or the system or the documents or the grant stuff specifically, you can contact me. I'm Beth, that's my email there. Not even sure I introduced myself. If you have some contact specific questions, we also have consultants on my team that have expertise in certain areas. So Liz, who's been working with me on this webinar, is our mental health consultant. That's her title. She's got the background and the expertise in comprehensive school-based mental health. If you're really looking at systems, like, what are you talking about, Beth, when you're talking about systems in place? Liz is the person to talk to about that, so you can reach out to her. If you're looking at social emotional learning specific kinds of supports, you can reach out to me for that. And if you're looking for information around trauma sensitive schools, you can reach out to Julian City, our school social work consultant, who is our project lead on trauma sensitive schools. You know, these are all things that are connected to school-based mental health. If you contact me and I think one of these folks can better help you, I will do a warm handoff to them as well, but you have supports here at the department. You also have supports through CESAs, and I know that we have a number of CESA folks online. And so not every CESA offers supports. We've put out a survey to ask CESAs what kind of supports they offer around social emotional learning, AODA, and grant writing. And if you click on that link, it will take you to a Google Doc with that information on the CESAs that provided it and contact information for the people that you can connect to for help. Some of the CESAs do charge for some of those services and some do not. If you are a current grantee, you cannot use grant funds to help pay for grant writing support. That would be an inequitable situation for those who don't have grant funds. And you can't use the grant funds to pay for after the fact for that either. So if you're going to pay for supports, these need to come out of your general funds to do that. Marcy listed something for CESA 7 folks, a link to supports there as well. Okay, and then just DPI support personnel. So I'm the school-based mental health project manager. Liz will be joining me on the project to offer support. Polly Tubbs is our grant specialist. I think Polly is on the call. I think I saw her join the webinar. And Polly is the one that you're asking questions to about budgets and grant awards and things like that. Polly speaks Woofer, I do not. So if you have questions about Woofer codes, you certainly can go to Polly. Oftentimes, business offices and Polly can have conversations and speak the same language that some of us don't. So Polly's the go-to person for those kinds of questions. Once you're awarded the grant accountant will be Mark Rudman, and Mark is the person that your business office will submit all claims to. And then just a final slide too, because I've had this question, I've had a number of consultations with folks about questions that they've had about the grant, and some have said, well, what about support if we get awarded the grant? So once you get awarded the grant, you're in a cohort. This last round, we had 106 grantees. Polly and I work very closely with the grantees based on what their needs and requests are. Some of our grantees, we don't talk too much at all, and others we support quite a bit, really up to you based on your needs. We'll provide consultation on plans. So this is something where Liz will be working with me in the next grant cohort, that we are both available to consult on plans and activities and things that you want to do in order to create that comprehensive mental health system. We provide consultation and support around budgets, completing budgets, budget changes, things like that. We offer peer and cohort learning opportunities. And then I just want to put out there that some of you might be aware of the new center that we launched this January, because it is February now, the Wisconsin Center for Resilient Schools. And this is a center that's connected to DPI and our WISH Center, a collaboration. of folks who are available to coach people to implement a plan. The Wisconsin Center for Resilient Schools is not the place to start if you don't have a plan and haven't begun the work. But once you start getting a plan in place, if you feel that your team would really benefit from some coaching in order to implement that plan, the Wisconsin Center for Resilient Schools may be an option for you as well. It's a free service. So, questions?
Yeah, so could the funding cover a de-escalation program or training like CPI or PROACT?
Yes, as long as, again, you connect it in your plan and it's connected to your goals. This is a lot to get through. I know you've got questions. I also have a consultation line if you and a team want to consult. I know Liz will do the same. So if you want to email us, we can work to set up, I'll connect you to my scheduling link, and Liz is scheduling the old fashioned way, but we can do some team discussions about your plan and some questions that you have.
Okay, we have another question. If you're already providing CPI training yearly, then wouldn't using these funds be considered supplanting?
If you currently have been paying for them, yes. However, sometimes what will happen is the CPI funding that your district was paying for was for maybe staff. Sometimes grantees will want to expand that to do CPI training for support personnel. And then the support personnel training piece could be paid. So if you're currently paying for it, you can't now use grant funding to pay for it. But if you're trying to expand work that you're doing to another group or resource or something like that, that is in addition to what you were doing, you can use the grant funds for that. Any other questions? Liz, I think there's one on.
Yeah, so a few folks have asked about goals for the current application. If you've already had the grant, do they need to be new or can they just expand on the work that's already being done?
I mean, you can expand. You might, I don't think it's unreasonable to have a goal that is a multi-year goal. What I would encourage you to do in your narrative pieces, like maybe in the needs assessment, for example, would be a good place to say, you know, we've had this gap that we identified in our needs and we've been working on it up to this point, but we still continue to require X, or we noticed that we need to do a focus on this piece of it in order to continue it. So you can have the same goals. It just isn't a bad idea in that application to expand upon what it is that you're doing differently so that you're not just repeating it. And also keep in mind that if you've had the grant over this last pandemic year, there were a lot of things that people could no longer do because of the shutdowns and things like that. And that may end up in your application for this time around, and that's fine. And also, to be perfectly honest, the reviewers aren't going to see an old plan, so they're not going to know. What they're going to do is review your application based on your current goals and plan.
Okay, and can services be provided in out of school time, like in cooperation with a nonprofit like YMCA or Boys and Girls Club?
Well, if it is mental health related and connected to your plan. So, for example, if you are doing a contract with your YMCA to do youth mental health first aid, that's possibility. You might work with out of school time or nonprofits to do some SEL work to continue the SEL. In fact, that would be an awesome project if you have a CLC project or an out of school time program and they want to continue the SEL work you're doing in school. You can use it to purchase materials and training for that. So it really depends on whether it's connected to a school-based mental health activity and whether it's in your plan and connects to your goals. What other questions do you have? So there's a lot to think about as you're going through the process. Again, keep in mind that there are the different contacts for you to get some support to do the work. And we encourage you to reach out. Liz and I can help you. And you have access to other services and some of your CSUS to do the same. Last call for questions, and then we'll send everybody on their way. Thank you for sticking around for this long presentation. This is going to be the only webinar. It will be recorded. Jennifer, we're going to try to get it recorded as soon as we can. It has to get closed captioned in order to be posted, and we'll try to get it on a fast track to do that. The slides will be shared on the website right next to the video link so that you can access them at the same time. And we shared them here. Might help. I can post them again in the chat here, but you can also access them right here.